South Africa has recorded nearly 4,000 new COVID-19 cases in the last 24-hour reporting cycle. This as the health department is warning that the country could soon slip into a fifth wave of the pandemic. Let's talk about where we are with the National Institute for Communicable Diseases Executive Director, Professor Adrian Puren. Prof, a very good evening to you. Welcome to News at Prime. So you have been one of the people who've been cautioning against perhaps a premature declaration of a fifth wave. But how much do these classifications matter this time around with COVID-19 when you consider how much progress has been made or how much movement there's been in terms of the variants, the spread epidemiologically, and the severity of disease?
Yeah, it gets very complicated in terms of the actual modelling exercises that were undertaken, I guess, in terms of the initial resurgences. So I think our term that at least that I'm using, and I think some of my colleagues at the NICD are using, is called a resurgence. In other words, it's an increase in the actual numbers, monitoring those particular trends. But I think, as we've always cautioned, it's very difficult to understand how the testing patterns are, how they come about, because again, I think the reasons for testing are not always obvious or clear, but certainly the numbers give us a hint as to what's actually happening. I think our focus really around monitoring the increase in numbers is certainly also monitoring the other key indicators, such as, for example, hospitalizations, looking at ICU capacity and oxygen utilization as key indicators. Of course, linking that very closely to what we can certainly see in terms of wastewater analysis, as well as monitoring what is happening with regard to circulating variants. I think that complex interplay, because more and multiple indicators certainly are available for us to give us a sense of what the actual resurgence looks like, but each has its own particular pros and cons.
So there has been criticism, right, about around the talk of a fifth wave from some people in the scientific world, some saying that unless we see an increase in the number of people, as you're saying, who are, for example, being treated in ICU because they're so seriously ill, or serious uptick in the number of daily deaths reported, we shouldn't even be talking about a fifth wave because it doesn't matter as a declaration until that changes. Is that advisable as a way to read the data?
I think in a sense, yes. I think what I think we're trying to say is that, yes, we are looking at a resurgence in the numbers. I think that's very important because I think from a planning perspective, that certainly influences our planning in terms of the province specifically, in terms of their ability to have beds available, oxygen capacity, sufficient staff. But I think it's complicated by the fact that we don't always know who's testing, because there may be many people who are not testing. And given the fact that we have in circulation the Omicron variant, which is high transmissibility, and the sublineages are thought to add, are even more, if you like, transmissible compared to the initial Omicron variants that were in circulation. So that just tells you that there are large numbers of people infected. I think what is key or critical is to look at, as I said, those lag indicators, which is really looking at hospitalizations and looking at deaths specifically. I know that we've had large natural exposures, so that's given us a certain level of protection. But I think what's going to be also very critical to say, well, who's ending up in our hospitals? I think just a couple of days ago, there was a paper released from South Africa by Professor Siegel, who looked at individuals who were unvaccinated and those that were vaccinated, and looking at the current variants in circulation, and noticing that, in fact, the drop in terms of immunity, or the extent of immunity in unvaccinated, is far less than those that are vaccinated. But certainly there's a decline in terms of the level of protection. So I'm sure that there are multiple reinfections occurring, in fact, but more likely in the unvaccinated than in the vaccinated.
When you often say South Africa is not out of the COVID-19 woods yet, what exactly does that mean? What is the main concern?
The main concern is that the virus has not, as far as many people are concerned, has not reached its exhaustion point in terms of what potential variants could occur. So I know that I think we would say that it's by chance, really, that we have a variant in circulation currently, the Omicron variant, where we've seen this disjunction between the numbers of cases versus the seriousness of disease. And that should not lull us into thinking that that's the final event for in terms of SARS-CoV-2. It is possible that another variant may arise that will behave very differently, similar to what Delta had done in terms of the numbers, but also the severity of disease. I think we need to be cautious to say that we've reached a point of endemicity. Endemicity is really when you have periodic presence of the virus in a regular fashion, if you like. You can have large outbreaks and quite severe outbreaks, but you can certainly see a pattern occurring. We're not at that particular point where we can say that we're in this pattern now of a virus that has infects large numbers of people and does not affect severity. It's still, in my view, it's still a very severe disease, and even influenza is a severe disease. But I think we just need to be cautious around simply thinking that we're now reached this point of endemicity.
How much do you think COVID-19 regulation fatigue is going to affect our ability as a country to manage, to whatever degree, the spread of infection this time round?
Yeah, I think that is an important consideration. I think we still go around, giving those particular messages, and we need to give those particular messages because it's really critical. But you're quite right. I think we've certainly came through, and I think that's very important. We came through the Omicron resurgence, the first Omicron resurgence at a level 1, for example. So I think some of those regulations, I think, are not going to have a major effect. It's really the key ones that I think we really need to focus on, and that's, for example, vaccination. Again, I really would like to urge our South African population to get vaccinated, especially in the old age groups, and especially those with comorbidities. And it's really critical, given that the evidence is there, that despite the fact that we will have large numbers, some people do end up in hospital. And it's really around unvaccinated individuals and individuals that are not fully vaccinated or have had their boosters. And I think mask wearing again and ventilation. I know that the different settings are critical. Outdoors, yes, the risks are far less, but again, I think you need to monitor those risks. If you're in close contact in outdoor settings without masks, the risks are there. Whereas I think indoors, again, if there are large numbers of people in close contact without masks, limited ventilation, then the risks certainly are increasing. So I think we need to give guidance, but it's really for the public also to assess their individual risks.
Professor Adrian Puren, always good to speak to you, so thank you for your time.